Apixaban to prevent venous thromboembolism in patients with cancer by Jocelyn Castillo. Definition. Apixaban, sold under the brand name Eliquis, among others, is an anticoagulant medication used to treat and prevent blood clots and to prevent stroke in people with non-valvular atrial fibrillation. Patients with active cancer have an increased risk of venous, which results in substantial morbidity, mortality, and healthcare expenditures. The Corona score range 0 to 6, with high score indicate a high risk of venous. Has been validated to identify patients with cancer at elevated risk for this complication and may help select those who could benefit from thromboprophylaxis.
Patients with cancer have an increased risk of venous thromboembolism, but parenteral thromboprophylaxis is not routinely recommended in practice guidelines because the absolute risk reduction is modest, and parenteral thromboprophylaxis is associated with an increased risk of major bleeding, as well as the inconvenience of daily injections. Could a direct oral anticoagulant such as Apixaban, used as a thromboprophylactic agent in patients with cancer, offer advantages over parenteral agents, particularly with regard to convenience? The randomized placebo-controlled double-blind AVERT trial included ambulatory patients with cancer who were at intermediate to high risk for venous thromboembolism with a Corona score of 2 or more. The Corona score has been validated to identify patients with cancer who are at elevated risk for thromboembolism. The trial patients were randomized to Apixaban for thromboprophylaxis before chemotherapy or to placebo before chemotherapy. The primary outcome was objectively documented venous thromboembolism over a period of 180 days. In a modified intention-to-treat analysis, venous thromboembolism occurred in 4.2% of the 288 patients in the Apixaban group and 10.2% of the 275 patients in the placebo group. The number needed to treat to prevent venous thromboembolism was 17. The main safety outcome was major bleeding. Major bleeding occurred in 10 patients in the Apixaban group and 5 patients in the placebo group. The authors conclude that Apixaban at the initiation of chemotherapy resulted in significantly lower rates of venous thromboembolism than did placebo among intermediate to high-risk ambulatory patients with cancer. The rate of major bleeding episodes was higher with Apixaban than with placebo. Full trial results are available at nejm.org.
Application in nursing. Randomized to an R Apixaban 2.5 ml PO by ID. Placebo. First dose of Apixaban or placebo administered within 24 hours of the first dose of chemotherapy. Patients were followed for up to 2010 days or death. No routine radiology screening. Pros and cons. First, pros. The use of direct oral anticoagulants as thromboprophylactic agents in patients with cancer can offer important advantage over parenteral agents, including route of administration, convenience, and cost. A previous small phase 2 trial involving 125 patients suggested that the oral factor XA inhibitor Apixaban may be safe and effective.
Well, the abstract I'm presenting relates to an observational study where we looked at over 14,000 patients with cancer-associated venous thrombosis. These were patients with active cancer, and they were followed in up to 6 months. And what we found was that when we compared DOACs, in particular Apixaban, with low molecular weight heparin and with warfarin, we found the patients with Apixaban had a lower rate of major bleeding when compared to low molecular weight heparin, and they also had a lower rate of recurrences. So there was about a 40% reduction in major bleeding, the most feared complication of treating patients with anticoagulants, and there was about a 40% reduction in venous thromboembolism recurrences, which is the aim of treating those patients to prevent those recurrences. And that compared to low molecular weight heparin. And that's unusual because a lot of the studies, particularly the randomized trials, have shown that DOACs in this setting might reduce recurrences, but they're often associated with more bleeding. But
Cons. Furthermore, the treatment of venous thromboembolism with therapeutic anticoagulation is challenging in patients with cancer because it often involves daily injection of low molecular weight heparin and is associated with a high risk of thrombosis, recurrence, and serious bleeding complications. Coexisting conditions that are common in this context, such as thrombocytopenia and renal impairment, as well as the use of concomitant antiplatelet therapy, further increase the risk of bleeding among patients with cancer. Issue apply in Ecuador. Statistics in Ecuador are scarce. However, an incidence of 1 per 1,000 population is estimated 10.27 venous thromboembolism affects the population over 4 years of age, with the relation of 1.3 to 1 in men and women respectively. The most current figures reported by Ecuador through the INEC are from 2004, which shows 2,024 cases of PIT nationwide for a population of 10,810,000 inhabitants. In conclusion, patients with active cancer have an increased risk of venous thromboembolism, which results in substantial morbidity and mortality. Also, a parenteral thromboprophylaxis can reduce the risk of venous thromboembolism among ambulatory patients undergoing chemotherapy. It is not routinely recommended in practice guidelines because the actual risk reduction is modest. A parenteral thromboprophylaxis is associated with an increased risk of major bleeding, high cost, and the inconvenience of daily injections. Thank you.